webinar on trauma-focused CBT, a culturally adapted therapy to work with Latinx families, children, and youth. This webinar is brought to you by a co-sponsor between the San Francisco Department of Public Health, Behavioral Health Services, Children, Youth, and Family System of Care, and the National Hispanic and Latino Mental Health Technology Transfer Center. I am Richie Rubio and currently the CYF Director of Practice Improvement and Analytics. So as we continue to celebrate National Latinx Heritage Month, it also calls for us to reflect on our clinical practices, especially in working with the Latinx community. Here in San Francisco, and more specifically in our BHS Children, Youth, and Family System of Care, we serve mostly Latinx children, youth, and their families. Currently, 32% of our clients. As such, we need to engage with our Latinx clients not only with cultural humility, but also with cultural competence. To this end, we work to culturally adapt our practices. As part of these efforts, we invited Dr. Isa Velez to share to us her expertise and experiences in culturally adapting TF-CBT. Dr. Velez is a clinical psychologist and a certified child and adolescent trauma professional. She's trained in TF-CBT, family therapy, and neurofeedback, and is becoming an international expert in culturally adapting clinical practices. She's currently working as a training and content specialist for the National Hispanic and Latino MHTTC at the Universidad Central del Caribe in Puerto Rico. So before we start with Dr. Isa Velez, I bring you again, Cindy.
Thank you so much, Dr. Rubio, and welcome everybody to today's webinar. Before we go ahead with the poll questioning, we wanted to let everybody know that the MHTTC network uses affirming, respectful, and recovery-oriented language in all activities. And on your handouts, you have the type of languages that we use and promote as well. And we also have a disclaimer that the presentation was prepared for the MHTTC network and it should not be copied by any form. And also we wanted to disclose that there's no conflict of interest from today's author and presentation. And with that said, I'm going to go ahead and launch the pre-test questions. And the first question says, TF-CBT could be adapted to Latinx adults living in the US that witness domestic violence. Is a true or false question? And 90% said true, 3% said false. Our next question, dichos, proverbs, can be used during psychoeducation or cognitive processing. Once again, it's a true or false question. And 91% said true, 9% said false. Our last question, the primary goal of TF-CBT is to reduce PTSD symptoms among children and adolescents. Once again, true or false? And 84% of the audience said true, 16% said false. That was our last question. So without further ado, I'm going to leave you with Dr. Velez.
Hello, everyone. Welcome to today's webinar. We are so happy to be here with all of you. Good morning. I'm right now. I'm in Puerto Rico, so it's like good afternoon here, but good morning to all of you. And I also want to thank Dr. Rubio for the invitation to present this webinar to all of you. And I hope that this webinar will help you to expand a little bit more the skills that you already have. And I hope that the resources that I will be providing today, it could help you to provide a more culturally adapted services to your Latinx clients. Okay, so during this webinar, today we're gonna talk a little bit about the TF-CBT components, but at the same time, we're gonna try to discuss some of the values that are incorporated in the culturally modified TF-CBT. I'm gonna provide some not guidelines, like some advice regarding how we can increase engagement for our clients. And because I know that it's really hard sometimes to engage some Latinx clients in therapy and Latinx families too. So we're gonna be discussing some information about that. And the case that I will be presenting is a 6-year-old girl from El Salvador that she was living in the United States, in California. So what I'm gonna do with the case is that I will present the TF-CBT components using this case. So you're gonna know a little bit more about what I did with this girl, with Maya. And through the components, I will provide some of the resources that you can share, you can have for yourself, you can implement it in your own practice. And one of the things that I usually try to talk to the participants of the webinars is like, if you have a notebook, if you're writing some notes, try to divide your notebooks and things to do, and the other side that you can write your notes. Because I know that sometimes we learn so much things and we forget, and we need to do something or to do some steps to provide the services, and we say, oh, I forgot. So maybe if you can write it down, your to-do list, I think that that's an idea that I try to use for myself too sometimes from the trainings. So first of all, the name of my client, it was changed for confidentiality purposes. And also that I want to clarify that I'm not like certified as a TF-CBT trainer, right? I took the training, but I'm not like certified in TF-CBT. I want to clarify that because I think that's really important. So again, welcome everybody. So we can start now. Next slide. Okay, so one of the things that I'm aware of, and I want to share this with all of you, is that when we are providing services, especially to minority population, we need to try to provide services that are focused on strengths-based approaches. In Latinos and Latinx communities, there are so many strengths in our culture that we need to take into consideration while we're providing services. It helps to increase commitment in therapy. It helps to improve treatment outcomes. So this is really important to check the strengths that the culture has and start from there. Okay, not only trying to focus on the things that I need to fix in this client, but also take those strengths to implement them in the treatment process. Next slide. So TF-CBT, I know that a lot of you already know about the TF-CBT model, right? I just want to provide you a review of it. It's a treatment that focuses to reduce PTS symptoms in children and adolescents, usually from 3 to 18 years old. But for the cultural adaptations for Latinx communities, you can use it from 4 years to 18 years old. And this model is really flexible, and you can implement it at schools. It could be implemented at churches. It could be implemented in different settings, in juvenile centers too. So I think this is just a beautiful model that could be implemented in different settings and can reach a lot of Latinx clients. I think that's another of the reasons why we are providing this training, because it is evidence-based treatment that help to reduce those PTSD symptoms in our clients. And it could be delivered from 12 to 16 sessions, but also we need to take consideration that I would say with Hispanics and Latinos and Latinx, we need to sometimes to increase a little bit more the sessions, but depending also on the trauma, on the complex trauma history that the clients present. So that's something that we need to be aware of. For the client that I work with, that are gonna be presenting here, I would say like almost 20 sessions with her and her mom. So we need to be aware of that. Next slide, please. So the culturally modified trauma-focused cognitive behavioral therapy, it include or integrate the different values that are present in the Latino culture, like familismo, personalismo, respeto, and also it talks about gender roles like marianismo and machismo, and espiritualidad, that means spirituality. So if you don't understand what they mean, it's okay. I will be explaining all of them in this presentation. So one of the things that it is important, like to talk about the cultural values and ask our clients about their values, because it helps to increase treatment outcomes. It helps to increase engagement also in the treatment. So that cultural identity that our clients present, I think is important to explore it, because it could be like a strength factor in our sessions, in our treatment. So let's start with some of the first of cultural value or belief that we can implement in our in our treatment. One of the things also to take into consideration is that sometimes the family that we are working with, maybe they could not present that some of the values, right? Because it depends on the level of acculturation that the client had present, but also it depends on the in the generation. First or second generations, you're gonna see that they have like more how to say, that you can see those values like right away. But maybe on other generations you cannot see it, like third or fourth generation of Latinx living in the United States. So the first one is familismo. In familismo, we can say familia es primero, or la familia viene primero. It's like saying like families go first, right? That sometimes family is really important for some of our Latinx clients. So family, we need to explore if there are extended family that are involved in that are caring for the child or the adolescent. Sometimes could be abuela, grandparents, grandma, right? Aunties, it could be like cousins. So we need to check if those family members are living in the same house, and also if they're like taking care, they're caregivers, right? That could have information that we could bring to our therapy sessions and will improve our treatment outcomes with our clients. So familism is that connection that we have with our families. And we don't want to stereotype also with this cultural values. So this is the reason why we need to explore through the first sessions that we have with our clients. So the next one that we have is personalism. In English is personalism. Refers to valuing and building interpersonal relationship. So sometimes we can see some Latino family that send you an invitation. Oh, do you want to go to my wedding, or do you want to go to my birthday, or you want to visit my home if you don't do like a rich treatment, right? So that's something that we need to take care, and we need to value that and try to be mindful and respectful while we're creating those boundaries with our clients. And how to create a warmth. It is important to create a warmth and welcome environment. I know that some of you already are providing services using telehealth, just like me. I'm seeing some clients from Boston. So I'm providing services using telehealth, and doing this for Latinx is kind of difficult sometimes, but I try just to say hi. If they want to watch a video of their favorite music in Espanol, we can do it. And also try to take a few minutes to just review some of the elements of their culture. You know, Latinx are so diverse, but I have clients from Guatemala, I have clients from Mexico, but I try to take some 2 minutes or 3 minutes, like, you want to share with me a song that you used to sing when you were young, or do you want to share with me like a specific festival that you celebrate in your country? So I think that's part of being a little bit more warm and welcome to their culture. Next slide, please. So respect influences the communication and social behavior. It includes setting like clear boundaries also. So usually in Latinos, depending from where they are, they can use usted or vos, that is o señor, señora, Mr., Mrs., because that we need to check out which one, if you're providing the services in Spanish, which one you feel more comfortable, and also which one the person or the mom or the father feels more comfortable with. Because I think Argentina use more vos or usted than other countries. So we need to try to ask how they feel more comfortable with. And this is key, because sometimes when we are providing services and we are explaining the rules of therapy, what is therapy about, we can see a lot of parents saying yes, yes, yes to everything that we say, and sometimes they are not understanding what we say. And because we have, like, in some kind of way, there's a power like imbalance, right? Because you have knowledge, you are the expert, right? So sometimes they try to say yes to everything, even if they don't understand why you're explaining to them. So try to incorporate some questions to check if they're really understanding what you're saying. Like, do you have any question? Do you understand? Do you think this is appropriate for your child? So try to implement some questions, because you can see that sometimes they say yes, 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 and it's difficult sometimes to understand. So regarding gender roles, we have Marianismo and Machismo. So Marianismo is that in the Latino culture, the Virgin Mary is like an image of motherhood. So is that like a dear role model for some Latinx, not for all Latinx, right? So sometimes that belief or that cultural value impacts a lot of females, right? If they were sexually abused, if they were having like a sexual relationship with a lot of young boys and things like that, they could feel like really shame, because they think that they need to be like the Virgin Mary. So we need to be to take that also into consideration while we are doing our intake, and also while we are providing the service. and machismo, I think that this is like some kind of controversial because in some areas it refers to the man's responsibility to provide to the family, but also it can be like a way to justify using the violence. So we need to be really careful about this. And what is the most important about the gender roles is that we can explore the family dynamics. Who is the one that puts the rules in the house? Who is the one that provides in the house? So those things are social things we need to explore it. And the last one is the spiritualidad or spirituality or religiosity. So a lot of Latino communities, they practice Catholicism, or it could be Christianism or another religion, or you can have Latinx clients that they are not, they do not practice any religion. So for the ones that practice Catholicism or are Christian, if you don't take in consideration their values about God or values about how they see life, I think they're not going to continue in therapy, because if that is like really central, and sometimes with a lot of times that they try to explain their symptoms, they try to explain the things that are happening to them using their spiritual language. So this is something that also we need to try to explore it, and it could be and help, and it could help us during the treatment process. I'm sorry, I'm like going a little bit faster. Let me go slower. I think I have so much information here. So when we're talking about spirituality, also we need to talk about is fatalismo. We can go to the next slide. So fatalism, I think is one of the things that impacts more the therapy process, and that we need really to be aware of this, because a lot of Latinos or Latinx could think that the bad thing that happened to me, the trauma experience, is something that I deserve, or God said that that in some kind of way it was my fate to experience that, so I cannot do anything about it. So maybe we need to try to see it differently, and acknowledge that value, but also letting them know that there's some like dichos como ayúdate y yo te ayudaré, like God help those with who like try to help themselves, right? So try to think how this value affects your clients' engagement in treatment, but also the treatment, like how it affects also the treatment outcomes, because we need to be really aware of this. Sometimes they say, I'm feeling nervous all the time, this is gonna be like this forever, nothing is gonna change, you know? Or they could think like, I deserve that trauma experience, I deserve like to be punished for something, or it was my fault. So this is something that we need to take consideration, and all those values that I explained are incorporated in the CM-TF-CBT, and that's one of the key, the values are one of the key concepts that make TF-CBT culturally modified for Latinx communities. Okay, so we can go to the next slide, please. So also, besides of the values, there are some belief, or there are like, I would say literature part of the Latinx culture, and the dichos, proverbs, and those could be used in psychoeducation, but also you can implement it in other areas of the treatment. So we have después de la tormenta llega la calma. After a storm comes a calm. And during auto-regulation, clinicians may take into consideration the meaning of some Spanish word that the students or the client have the meaning of those words to them. Usually, I try to let my clients know if you experience that trauma in Spanish or while you were in your country, while you were speaking Spanish, you can process and you can talk in Spanish or English. You can choose the one that you want to or that you prefer, because usually it doesn't have the same meaning. Is the experience happen when they're living in Guatemala, El Salvador, Mexico, and that everything was in Spanish? Sometimes it helps to do the narrative in Spanish too. So I encourage them to use Spanish and also English if they want to, like try to use both at the same time if that helps them. For maybe third generations that they grew up in the United States, maybe they say the whole narrative in English and it made more sense to them, and it is okay too. So I want to all of you, or some of you can write down some of the details or proverbs that you use in therapy or that you use for in your professional or personal life. If you can think of those, and if you can share with us in the question box, it will be amazing. We can read some of them. I'm gonna give you 1 minute. Cindy, you wanna read some of them, or Christine?
Yeah, we're getting many. No hay mal que por bien no venga, ojo al Cristo, todo tranquilo, la que resiste persiste, hoy por mí, mañana por ti, cada cabeza al mundo, and we're getting a couple more.
And when everything happens for a reason.
Dime con quién andas y te diré quién eres, al mal tiempo buena cara, que es una raya más que un tigre.
Oh, I haven't heard that one. Oh, wow. So there are different books also that therapists can buy that talks about different issues, and you can implement those inside your sessions with Latinx clients. There's no rainbow without rain. Thank you. God will not put more on you than you can handle. Thank you very much. El que se enoja pierde. Okay. Thank you for all of you for sharing those details of proverbs. And I think it helps sometimes our clients to feel more encouraged, to feel more empowered, and also to explain that the verse or the details, the proverbs explain what they are experiencing, right? So also besides the details, we have cuentos. So cuentos is like short stories that we can incorporate in our sessions. And cuentos, usually we can incorporate it during the cognitive coping and processing component. So one of the cuentos, you can use it for teenagers, but also you can use it for kids. And one of the cuentos that I want to share with you that is on the TF-CBT book, and we can go to the next slide, is this one, The Little Red Ant. So this is like kind of a story that talks about that it was the ant. There was an ant that was smaller than everyone else, and thus believed she was weaker and different. One day, I'm sorry for the noise, I have 2 kids here. One day, she came across a piece of cake that she early wanted to bring home for her family to eat. She did not believe that she could carry his cake by herself. And as she came across many other animals, she asked them to help her. However, no one could help her in the end, she told herself to at least try to carry the cake before giving up. Sorry. And it ended up that she was able to carry the cake by herself after all. How many of you hear about this short story? I think it could empower our kids to feel like, you know, you have a lot of strengths inside of you that you can use it. Right? I think it's really a really good short story. But you can find other short stories in Mexico and Guatemala. You can ask your clients too if they have a specific cuento or short story that are meaningful for them. Okay, we can go to the next slide where so we're gonna discuss a little bit about the therapeutic elements that helps us to increase engagement. I'm sorry, I have something on my throat. Right. So which are those elements that will help us to increase that engagement with our families, the families that we're working with, and how we can defeat sometimes the mistrust or the fears that they are experiencing towards mental health providers? I think that's the main question that all of us have. As a therapist too, I can see some of my clients from Boston, they take for granted to have a Spanish-speaking therapist. And I need, like, sometimes it happened with one of my clients, I need to take the time to explain to her, like, what we can do so we can have more consistency in our sessions, or what we can do to have, like, a specific day where we can meet. And to have that conversation, because if we don't have it, sometimes you are, as a therapist, you're like angry, like they're not compliant with the sessions, but we need to check out what is happening. Is the person needs to work at this time? Is the person a single mom with 3 or 4 children on her house? Is the person like also experiencing a lot of trauma? Or also another family is sick or something. So we need to try to have those conversations too when we have clients that stop going to therapy, or like they're missing a lot of sessions. Okay, so this one, the engagement phases strategies. First of all, we need to establish that need for mental health care, because this happens that the kid was referred by DCF or was referred by school to have therapy, and they sometimes a Latinx parent don't know why they were referred for it. So try to take a little extra time to explain this is therapy, what it means, why we are providing the services, or why we're going to do TF-CBT with this client. What is it about? What I need from you as a parent? Actually, what is the difference between a psychologist and a psychiatrist? Because sometimes they can see you as that you're gonna prescribe some medication to them, and a lot of Latinos they don't like to have medication. To take medication, because they feel like, first, that they are crazy, second, that they are addicted. And for some countries like some Dominican Republic, if they're religious, they can feel that taking medication is like a theme. So we need to explore that also. So enhance caregivers' motivation for treatment. So we can let them know what are the benefits of treatment, you know, because sometimes they don't know about it. One of the things that I try to let them know, like, you have a kid, your girl, like, she is like having difficulties identifying their emotions, her emotions, like when she's angry, when she's really sad, or when she feels frustration. So instead of saying like we need to reduce those behaviors, we can say, do you know that sometimes your girl is biting herself or is hitting his brother like all the time? So when we provide some education about different kind of emotion, how do you feel in your body, and try to provide an alternative like coping skills, it can help them to figure out what is happening with her body and her emotions, so she cannot continue to be hitting his brother or biting herself. So maybe to take that extra time to explain those behaviors, it could be helpful also. Preview experiences of therapy. I have a lot of clients that came to the office like saying like, I had previous therapy and I'll stop going. The person wasn't warm enough, he didn't know about Latinos, or they could say that the person did not understand how they were feeling or how to help them. So we need to check out what happened in the previous therapy session, what worked and what didn't work for them, so you have a little bit more understanding of what happened. And then the things that work, you can use it in your sessions, and you can implement strategies to deal with those things that didn't work for the client. Okay. Explore concrete barriers. Sometimes we have clients, they don't have food in their houses, they don't have a mattress, they are sleeping on the floor. There are several families living in the same apartment or a studio apartment. So we can explore like if they need services for food, do they need service help with doing the homeworks, right? Because homework sometimes are in English and we can have some parents that only speak Spanish, right? So try to explore the barriers to treatment, but also if they're lacking of some resources. And establish a collaborative working relationship. And how we can do this? It's just like being transparent, being genuine, being you, right, as a therapist. And sometimes being there as a therapist can change a lot, because the families, the Latinx families are really underserved. And you being there, connecting with that family that you're working with, it is the first step to provide the services that this family have, but also to change their lives, right? Because not always they're open to receive services or mental health services. And being transparent, we need to talk about expectations. We need to talk about the time that we're gonna, let's say if you're gonna provide session for 45 minutes and then you will need like a 15-minute session with the parent, right? We need to let them know that every other week or every other week we're gonna have some time to talk to the parents. Okay. So we can go to the next. I think some of the things I already said before. So the therapeutic relationship is really important in this process. And it starts since we talk on the phone with our clients, right? Being nice, we want to say, hola, ¿cómo está? Mi nombre es, present ourselves. This is basic, but it is really important for our Latinos, right? So we can start with the TF-CBT components. Let's go here. So the TF-CBT components of the cultural modifier are the same of the basic TF-CBT components. We have psychoeducation, empathic and skills, relaxation, affective expression and regulation, cognitive coping, trauma narrative, in-vivo grad exposure, co-joint parent and child session, and enhancing safety and future development. I want to clarify that co-joint parent and child sessions can go through all of the components. Okay. So the next 2 slides is just, this is the steps. And one of the things that I did when I was providing services in California is that we developed like a sauna, kind of like a stair with the different steps with a Lego, like Lego stairs. And the client, when he finished one of the steps, so he goes up with the Lego. So this is something that you can use for yourself. You can print it out. This one is in Spanish, and the next one is in English. Yeah, you have it there. So you can use it. I think you can find it also on Google, but I want you to have it. We can go to the next slide. So first, a little bit of the background of my client. She was a 6-year-old girl from, she was living in California, but her family was from El Salvador at the time that I started providing services. And sessions with mom was in Spanish, and sessions with the client was also Spanish and English. She was able to write and read in Spanish and English. And she was in the 1st grade, living in 1-bedroom apartment with her grandmother. And the main reason she was referred to receive TF-CBT is because she experienced, she witnessed domestic violence, but also she was physically abused by her father. Her father was from El Salvador too. The parents separated, and there was an agency that was helping them. It was Peace Over Violence, and these organizations helped with the coordination with the services in the agency that I used to work, and help the family with different resources. And the mother was really consistent with the therapy session. There was like a wonderful family. I would say this is a star case actually, because they're really consistent. The girl was really smart, intelligent. They were always on time for the sessions. And I think that makes a huge difference with this case. The biological father, he used to be physically violent toward the mom, but also toward the girl. And he had an alcohol addiction, and my client was presenting some of dissonance, because like, he was my father, he is my father, but also I miss him, because at the time that I was providing therapy, she wasn't able to talk to her father. At first, she used to talk to her father on the phone, but after they have another another appointment with another juicio, I forget the name, but they went to court and they have a court order. They cannot have like a more phone calls. So she was feeling pretty sad about losing that connection with her father. Next slide. So she experienced domestic violence since she was her mom's belly, right? So it was prenatal trauma. And some of the things she was presenting was really sad, depressive mood, and a lot of anxiety. She was biting her nails, and she was also hyper-aroused. She was like really like aware of her surroundings, and it's part of her trauma history. She was presenting some flashbacks, usually when she was at school or when she was at home during nighttime. And this is something that we can see in a lot of clients, because sometimes usually trauma happens at night. So we can see a lot of clients presenting a lot of more flashback at night before they're going to bed. She was also presenting some nightmares and fears of her father, but also having that dissonance that I want to talk to my father. And grieving her father, she said, no puedo hablar con mi papá. Like this really, it was really sad for her that I want to talk to him, but actually I cannot talk to him. And she was also explaining in the session that that she wants to talk to her dad like in the mornings, and sometimes when dad was drinking a lot of alcohol, she did not say bye to her dad before going to school. So she also explained that when she was living with her father, she on the morning she feel kind of sad because she always want to say bye or dale un besito, like a kiss, like goodbye kiss, but she was unable when the father was drunk. So we start providing TF-CBT for this client because of her trauma history, because also the mom was able to go to the center and to be she was the main caregiver, right? And one of the main concerns that the mom presented is like she was that the girl started crying at school, or that the girl sometimes was irritable, um, and that the girl was some kind of having a lot of nightmares at night. So those were the main reasons that the mom expressed to me through the first sessions. So before starting with the model, with the TF-CBT, we did an assessment, and because I was working with an agency that was doing some kind of research, we need to do a specific assessment. We need to use a specific assessment tools, and for this case, I used the UCLA PTSD Reaction Index and the Youth Outcome Questionnaire. So as you can see, this is the parental report of the child behavior 7 days before starting the treatment. And she was presenting a lot of interpersonal distress, somatic symptoms, difficulties with interpersonal relationship, especially with her mom and grandma, social problems, behavioral dysfunction, and there is a 10 of critical items. We can go to the next slide where you can see the overall, the total score, that it was 97. So she was presenting a lot of symptoms, right? And she qualified to receive TF-CBT services. Also, we need to be aware that this family, I think they were really smart, they were really top. So I think that they were able to really express how the mom was really able to express how the girl was feeling. But we can see families that they can say, no, my girl is not having nightmares, my girl is not having headaches or stomachache. They can say a lot of no, and we need to try to explore that, because sometimes it feels better to deny everything than to acknowledge that. Okay. So I would say, even though the client does not present like a lot of symptoms, if you have a clinical, if your clinical gut, let's say, gut say that, okay, I think something is happening here, so I think you are able to provide the TF-CBT if the person is experienced a traumatic event. Okay. And I'm saying this because I had a client, I was doing like a forensic interview and a psychoeducational assessment, and I was providing the A score, and through the A score, this was a 30-something woman, female from Guatemala. So she was saying no to everything, no, no, no. But then she, like, talking to me, she said, yeah, my father used to beat me, my father used to get drunk every night. So I tried to ask the question, okay, but you say no here. Do you think that this one is a yes or no? Because you said this and that. And then she was like, I think it's a yes. But it was difficult for her to say, like, yes, my father was this way, because she feels like she was in some kind of way talking bad about her family. Okay, so that's something that we can see in our clients too. So I want to say also that there are other assessments tools that you can use. You can use a trauma symptoms checklist for children. That also could be implemented. For if you want to explore a little bit about the acculturation process, you can use the acculturation rating scale for Mexican Americans. This one is for adolescents and adults only. And the multifaceted assessment of cultural constructs, that also you can use it. It's multifaceted assessment of cultural construct, short form. You can use it to check if your client presents some of the cultural values like familismo, fatalismo, folk beliefs, or personalism and gender roles. So that those tools you can implement it. And I would recommend also to use the cultural formulation interview, DSM-5 cultural formulation interview, because I think that that interview is not specific for Latinos, right? It is specific for all, but to minorities. But you can use it to explore about how the person expressed their emotions, what was helpful, what they did to try to find help, and what worked, what didn't work, and how they see the problems or the symptoms that they are experiencing. So I think that the DSM-5 cultural formulation interview, I think it will be really useful, and mostly if you do not usually work with Latinx families, I think this will be really helpful. So the next slide that I have here is the UCLA PTSD reaction index. This is the other assessment tool that we use. And as you can see, the girl experienced a lot of we experiencing avoidance, arousal. But the total TF-CBT was under the threshold, right? Sorry. So in the, yeah, we can go to the next one so you can see a little bit more of the general scale. So this one was the child's report. So for this one, the parents, I am alone with the parent, and I take notes for what they say and answer the questions. And then I had a session with the girl, and I did those questions to her, and she let me know. And something with that we can see that they're almost alike. Okay, so the first step of the psychoeducation, I'm not going to explain like a lot about what we do on that component, but I want to talk about what I did with this client, right? Because I know a lot of you already have that training on TF-CBT, so that's good. So during the psychoeducation process with this family, because they experience TF-CBT, we use the power and control wheel, and that explain all the behaviors that we can see, like intimidation, emotional abuse, and that cycle. And the client was able to understand them, provide examples, and while I was providing this psychoeducation, she was able to say, oh, my father did this, and my father did that, and my father thought he was the king of the castle, and he was taking control of the money. He didn't give money to my mom. So she was able to make that connection of the experiences that she went through and what it said. So then she was able to explain this wheel to the mom. At the end of the session, usually we have that time with mom, and she was able to explain to her like everything that happened that was happening on her family, right? And that she observed that her father was doing. So one other thing also, we try to validate those emotions that the client was experiencing and the concerns that mom was having, right? She was like, I don't know, she's really sad, I want to help her, but I don't know what to do, like how I can do it. And this family already was doing a lot of things, like they were going to the park, they were like reading some stories together. What else? This family also, they're really close, like the grandma and the mother and daughter, they were really close. So they had that space to talk about how they were feeling. Give me a second, wait. Sorry. So in this process, in the psychoeducation one, you can implement and you can check the families, the value of familism. You can check if that is really important for our family, and we can try to check if we can implement other family members in our sessions, okay? Because if another person is raising the kid, if another person was there when the trauma happened, it could help us to gather more information, and also we can provide some tools for the other caregivers that are there with the kid, okay? So we can go to the next slide. So here are some resources that you can use, some of them in Spanish and English. And this one too. So these are 2 books. During the next component is the relaxation component. In this component, we try to reduce those physiological and arousal associated with the trauma reminders. And with this girl, what we did is we provide guided imagery. We provide the basic one, that is deep breathing. And one of the things that we can incorporate in this sorry, is prayer. When we have clients that they have really strong cultural belief, if they have really strong cultural belief, the prayer could be something that they can implement. So if they have this value of spirituality, we can include prayer. And here are some of the resources that you can use in this component. The Cosmic Kids Yoga, there are different yoga videos that kids can do. And the Caleta de la Nutria. Sorry. Caleta de la Nutria is a short story that helps the kids learn about deep breathing. And this one is in Spanish. In English is the Sea Otter Cove. Can you share with us in the question box a tool that you use? Sorry, a tool that you use for relaxation? Cindy, can you check?
Yeah, they're coming in.
Okay.
We got a couple of tapping, breathing practice, painting or drawing. Someone mentioned Plum Village app. It says in parentheses Buddhist. ASMR on YouTube or Spotify. And then more breathing, guided visualization, music in general. More or less, that's it.
Yeah, and they're really good. And the progressive muscle relaxation is one that I usually try to use for my clients too. Thank you. During the effective expression and regulation, it helps the clients to improve the vocabulary. And here, Maya was able to write like some of her feelings, like using different emojis. And we use also the TF-CBT workbook that's really helpful. On other slides, I have the link so you can have it and you can check it out. We use play therapy, so with different with animals that have different like emotions, and the feeling thermometer. So we can help our clients, and usually Latinos. Some of the families are more in touch with their feelings, but some others like they don't talk about feelings. And this is one of the questions that we can do. I'm gonna take a second to get more water, and I will just come back just like 30 seconds. I apologize. Okay, I think I'm a little bit better. So, as I was saying, that in this part, the affect expression and regulation, it could help us um, to improve in that the words and the vocabulary that our clients have to express their feelings. Because usually in Latino population, we're not used to talk about feelings. And while you provide this component, you can explain the definition of different emotions, how it feels in our body, how the kid or the adolescent can acknowledge when someone is feeling angry, when someone is feeling sad, when someone is feeling tired, right? So those things, and usually just going to the dictionary and explain this is definition of anxiety or depression, it helps them a lot to understand and acknowledge those emotions that they are experiencing. We can go to the next one, please. So the cognitive coping, it helps children distinguish between thoughts, feelings, and behaviors. And also, through the session, I incorporated the mom and I let her know what we are doing and the reason behind it, right? Because we need to have mom or father or the caregiver engage in this treatment process. And also, you can model her how to practice the different coping strategies or relaxation strategies with the kids. So we can go to the next slide. So here I provide some of the resources that you can check it out or that you can use while you're providing TF-CBT. I have one in Spanish, 6 fábulas con moraleja para niños. So there, like it is like a YouTube video with different fábulas. It's kind of short stories that are not real, right? That you can use the one that it will help your client, you know, because they have different topics. So for with my client, we did like, then we identify the connection between thoughts, feelings, and behavior. And one of the things that we use to do that is the Triangle of Life app that you can see on the next slide. And it is an amazing lab. Is the Triangle of Life. So that application, you can use it as a way to help your clients to understand what are thoughts, what are emotions and feelings, and to acknowledge that the difference between them. Okay. And I, with you during this session, we tried to check and let them know, like, when we have negative thoughts, or we can use maladaptive thoughts about something. Usually that thought is related to a negative or maladaptive emotion, and what we do sometimes will not help us to reach our treatment goals. So we try to challenge those maladaptive thoughts to other that are more adaptive. You can go to the next one. So during the trauma narrative, I think this is one of the crucial moments in the therapy session. Usually when you're delivering a CM-TFT, TF-CBT, we can try to check, to talk a little bit about the trauma through all the components. So this part is a little bit more easy for the child or for the adolescent. So this girl, she was really open to share about her family and about her trauma experiences with her father. And she was more open, where we can also have clients that they don't want to talk about what happened. They don't want to express their feelings. They don't want to think about it, right? And one of the things that I try to explain to them is like, we can see that trauma experiences like a monster, right? Como un monstruo, como algo feo, algo grande. And that monster goes bigger and bigger and bigger. Ese monstruo se hace más grande y más grande if we don't confront it, if we don't defeat it, right? It gets bigger and bigger. So what we are doing in the therapy process is saying, okay, I'm scared because of that monster, but I'm gonna defeat him. He's gonna get later and later. So through all the components, we are doing that, and the trauma narrative is part of that too, to confront that situation and those feelings, but with someone that is going to be there to help you in that process, to be there with you. So here is when you can implement some cuentos. You can implement, there are some videos on YouTube in Spanish that maybe talk about the experience that maybe the same experience that another person went through, and that could help you, and that could help the client also to feel validated and normalized, like other people experience this too. I'm not the only one. And my client was able to write her first chapter. Usually it's about talking about yourself, things that you like to do, things that you enjoy, right? This is a good way to start. And you can see that on chapter 2, so she talks about different experiences, like her happiest moment. And she explained that when she went to I think it was like a Chuck E. Cheese thing, and she had so much fun and she got a prize. So on the 3rd chapter, I think I have a picture. Yes, is when she started discussing some of the traumatic experiences that she went through. So for her and her family, one of the values that are really, really important for them was like being connected to her family, and being together and spending time together and celebrate celebrate cumpleaños and to celebrate Christmas together, Navidad. So that's why it was more difficult for her to being separated from the father, because that was crushing to that value of family. We can go to the next slide. And through the narrative, I see, I do this narrative with the children first, and then I read to the mom the narrative alone, and we try to coach the mom what she can do, what she can say, if she wants to clarify some things of that story. And she was really amazed, like, oh my gosh, you remember that? And like, she didn't let me know that she was feeling that way or she thought that way. And that is the perfect moment to clarify how she was feeling, to clarify misunderstanding, or to clarify what happened. And also to validate the emotions that the kid was experiencing. In the in vivo graduate exposure, with my client had a lot of fears to police officer because it happened that one, like twice, but she remembered one. The police officer went to her house and she felt really scared because the father was arrested once. So for her, like seeing police officers was a trigger of that trauma history. And usually when she sees the police officer, she would start crying, or she was like, I don't want to see him, or she was like clinching to her mom, like apretándole la mano, right? Because it was a reminder of the trauma. So what we did during this component is like I talked to a police officer that someone knows in the agency, and he was able to go. But before doing this, I was like I let her know that if we can do this, and she was like, yes, we can do it. Let's try this. And I let her know, like, we're gonna do like a game. You're gonna be a reporter, and you're gonna have a chart. You can ask the questions that you want to. Like, if you have a specific question, do you have concerns, why they do, why he became a police officer, you can ask the questions that you want. So she wrote down the questions, and the day that we did the in vivo exposure, the police officer, that he was really nice. He went to the office. He was without his uniform, so he was like in jeans and a shirt. So he went there. He explained to her like who he was, his name, and then she's just sitting on my chair, crossing her legs with the board and asking him some questions. So I think this was so powerful session, and it was kind of really different, and I really enjoy it. But at the same time, I was seeing like the process of healing, right? Like to be facing that monster, one of the monsters that she was experiencing, and she was able to do the questions. She was able to understand why the police officers go to other people's houses and things like that. So after that, she feels more calmer, and the mom was also there with us, and she asked some questions to the police officers too. So I think this also is really powerful session. So we can go to the next slide. It's almost the conjoined parent session, as I mentioned, it goes through all the therapy session, and it will help us. One of the things that I say to my clients is like, I want you to know everything that I know about trauma. Let's take that time of providing mental health services to help our clients know about trauma, how it feels like. If you can share with them some videos, you can share with them books, you can share with them information about what is trauma, how it affects our body, how it affects our emotions. It will help them to understand more and more, and you're gonna see how sometimes they use some vocabularies in the session. For this girl, when in the last chapter, she write down things that she learned from therapy, and she's used words like, I know I passed through trauma, my trauma was domestic violence, and she used those words like, I learned how to practice deep breathing. So when you see those things, you say like, yeah, She understands it, she's practicing it, she's not gonna forget about it. It's really regarding to see those things in our kinds. So I try to teach the moms or the caregiver everything that I know about trauma, in this case specifically to domestic violence, acknowledge those cultural elements that are important for them, that are crucial for this family. I will say spiritualismo, in familismo. There were some of the values that were more, that were key for them, and also respect. Because when the girl was really irritable and she respond back to the mom, she is feel like that the girl wasn't respecting her. So that's another value that we try to acknowledge and to talk through. So, and the last part of our components, right, is the enhances safety and future development. So here we provide education and try to expand safety. And for her, one of the things that she expressed is like she was like more aware about the will of power and control, and I think that was key. I give them a copy. I give them a copy in Spanish and English, so the mom also have it, and I think that to increase safety and to continue providing healing to this family, I think that one of the recommendations was to the mom to get her own therapy too. That is going to be also helpful, like indirectly to the girl. And here she learned like to, if she sees, also we developed a safety plan that I didn't said, sorry, but we developed that safety plan with the school also. And she knew that if I see my father here or uncle or someone else was going to pick me up, I cannot go to with no one. I just want to go with my mom. If something changed, my mom will let me know before. So that's something that we need to be, that we need to discuss with our clients, that safety. So that domestic violence experience, we don't want that to happen again to this family. So we need to continue providing education and training about what is domestic violence and how we can take care of ourselves. And as you can see now, the results after we provide the sessions, we provide the post assessment. You can go to the next slide. So for this kind, everything dropped. Okay, so interpersonal distress, it means anxiety or depression, it went down. Somatic symptom, headache, stomach aches, it went to a 0. This is the parental report. Interpersonal relationship from 15 to -1. So she wasn't experiencing enough to 1. Yeah, to 1. Social problems from 7 to 1. Behavioral diversion from 20 to 7. So it was a huge difference. And critical items from 10 to 2. And we can see on the next slide that after she received that treatment, we did like almost like 20 sessions. She went to 97 to 16. So I think that was a huge improvement in this client. And one of the things that I would say is that the family has so many strength from them and commitment with this therapy session that they did a tremendous effort to go there. They did not have a car. They went in a public transportation. They were on time. And also we need to celebrate that. So on the last session with the client, when we finished all the components, we did a celebration. So I asked her the week before, like, what do you want to have on that last session? And she said, like, I don't know. I said, like, anything, a specific food that you want. And she was like, yes, I want tamales. And I said, okay, so I will bring tamales. We're gonna have a party here. This is good. gonna be our last sessions, and you did so much work here, so we need to celebrate that. So we did like a small celebration. I give her like a certificate of completion of completing TF-CBT, and all the work that she did, like the sheets that she completed and her drawings, everything. I put everything in a binder, and then I give it to her. I give it to her, the copy, to the mom, without the trauma narrative, right? And I put everything there, and I let her know like this is part of the enhanced safety. Like if she forgetting something, that she can go to that binder and check it out and read it again. And the next slide, it's also the UCLA PTSD reaction index. Almost everything went down. And the other one, the child report, also it went really low scores. The abonnents went from 8 to 0. Really impressive. So here we almost, time almost up. So the last few slides are resources. So this is the link for the TF-CBT workbook in Spanish. Yes, in Spanish. We need to acknowledge that TF-CBT, even though it was translated to Spanish, it wasn't adapted to Spanish. So as a therapist, you need to go to the TF-CBT book, and on the chapter 10, you're gonna see the CM-TFT, that it will help you a lot to understand better how to incorporate those values and belief while you're providing services to Latinx. You have also, there's the TF-CBT for adolescents, but also for children. And the Cuaderno para Adolescentes, you have the link there. And dealing with trauma, a TF-CBT workbook 14. So you can check it out. You have the kids one and the adolescents one. And the next slide, if you want to continue to have more training about TF-CBT, you can go directly to their web page and try to check, because there's different trainers. You need to check, like if you want to provide services to Latinx, you need to check on the description if they provide CM-TFT, because usually they're not incorporate those modifications on the trainings. Okay. Next slide, if you have any questions, and let me know. I'm really happy to answer those questions.
Yes, Isa, we actually have a couple of questions already for you. I'm going to go ahead and start with the first one. For supporting clients' use of their perhaps first or most comfortable Spanish language vocabulary, are there suggestions for non-Spanish speaking providers for respectfully encouraging use and sharing of the meaning of these words or phrases to best support their background and cultural identity, while not making it their job to teach us as clinicians?
So I would say that the question, Cindy, was related how to explain, let's say, the cultural values to our clients when there is a non-Spanish speaking provider.
No, I think it's more in terms of like they know the fact that Spanish is not their language, and they don't want to make the client like go into the job of explaining or teaching them the different phrases or vocabulary that they might use in Spanish. So how, like, they're asking if there's any way that providers could respectfully encourage the use of sharing those meanings, but without making it a job for the client.
Without making it a job. So if it is regarding if we're talking about different kind of emotions, like I usually try to explore the emotions in our sessions and write it down, the emotions, and check it out with my client. If it is regarding the cultural values, we can try to ask them questions regarding what are the most important things for you, like what do you usually care about every day. Can you share with me like some of the best experiences that you had before or right now, or the question of the 3 weeks, if you I was if I have a magic lamp and you have 3 wishes, like which 3 wishes do you will ask, and that will help us explore a little bit about the values that this client have or present. I don't know if I answered the question, Cindy.
Yeah, I mean, we haven't received anything else, so if it didn't, like, they can write to us and I'll make sure, like, I'll be on the lookout for that. While we do that, I'm gonna go ahead and make the second question.
Yeah.
How do we try to have young adults identify their goals in therapy to begin engagement?
Can you repeat it again?
How do we try to have young adults identify their goals in therapy to begin engagement?
Okay, I will identify the goals of our clients. So while you were, first I will ask the question, what brings you here, or how I can help you, right? After you have the answer to that question, I try to listen to their narrative, like to have the history of my client, and I on my mind I conceptualizing what is happening with this client, and I have on my mind like an idea, and I can write it down on my notes so I have so I don't forget about it. And after my client finished that first session, I just let them know, like, I thought that you talked to me that you are presenting experience difficulties managing different emotions, and that sometimes it's difficult to talk about that trauma experiences. So using that narrative for my clients, what they say during the intake, I try to do I try to acknowledge that and try to incorporate that on the goals. And I let them know, like, you know what, this is like the trauma that you're experiencing is impacting this area of your life. What do you think if we can work with a trauma informed and our TF-CBT that focuses on those trauma, and we can have the space to talk about it. I can bring some coping strategies that you can implement to manage your emotions. You have a specific space here to talk about how you're feeling, and that is a safe space for you. So what I try to do is like to explore through their narrative or the goals for the sessions, and I let them know. So I think that our main goal could be this one. What do you think about? Do you like that, or there's something else that you want to work? So that's how I do it with my client, and I ask them. And I include their goals, but also if I see other things that we need to work with that the client's not seeing, I let them know. I think that you need to increase the activities you do out of the house, or you need to increase interpersonal relationships. So even though you're doing through Facebook, through Zoom, right? So I do it like that, like try to talk to my clients about it.
Thank you, Isa, for that. That definitely helps. So the third question was regarding on a couple of assessments that you listed, and they asked if you could repeat the acculturation assessments.
Yes. Let me find this slide. Okay, so the name, okay, I will mention the acculturation rating scale for Mexican Americans. I can share it. Okay, so acculturation rating scale for Mexican Americans And the other one is the multifaceted assessment of cultural constructs, short form. So those. Okay, I will share that on the chat box. Okay, there on the chat box.
Thank you, Isa.
Sure.
I just saw it, so everybody should have received it as well.
Yeah, so you have those two, but also the one that I mentioned is DSM-5 cultural formulation interview.
Thank you. I don't think we have time for any more questions, but I don't know if you want to share your email, because I know some people. Oh,
Yes.
there you go.
Yes. So
Awesome.
feel free to ask any questions. I would be happy to answer them. This is my email, my name, my email. Send me a message, and I can respond to your questions. And yeah, remember that we are here to help you, the National Hispanic and Latino. We're here to provide training and help you. And thank you, Dr. Rubio. Thank you, Cindy.
Thank you so much, Dr. Velez. Really appreciate your time. I think Cindy has some last message.
Oh yeah, I wanted to remind everybody, because I know that some people ask on the question box about the evaluation and such. You're gonna receive an email with a post survey, which has like the post questions that we made at the beginning, and it also has a link for our survey. Make sure you're on the lookout for that, because that's very important for us to keep up this work with organizations like yours. So nothing, I just wanted to remind everybody that it's gonna go directly on your email, the one you use for like registration and to come in today. So that was it. Dr. Rubio, go ahead.
Okay, thank you again. And again, for everyone, take care and stay safe and healthy. Have a wonderful day.
You too, thank you.